And resolutions and announcements. The first item on the agenda is a resolution recognizing Don Butler, and that's been requested by Mayor Terry Frank. Mayor, you have the floor.
Thank you, Commissioner. Don, would you like to come up here with your family so we can recognize? Yes, you do.
You're invited.
So how often do we get to recognize someone who not only has volunteered to serve this county on a board or a committee or a commission, but has done so for 36 years in a row? And that's why we're here to recognize Mr. Butler this evening. A resolution recognizing Mr. Don Butler for 36 years of service as a member of the Anderson County Board of Equalization. Whereas Mr. Don Butler is an Anderson County native who attended South Clinton Grammar School and Clinton High School. And whereas after graduating high school, Mr. Butler traveled up north where he worked for Caterpillar for a couple of years before he returned home to East Tennessee. And whereas Mr. Butler was first appointed by then County Executive David Bowling and the Anderson County Board of Commissioners as a member of the county's Board of Equalization in July 1985 to fill a vacant position. He was reappointed to a full 2-year term in March 1986 and continued to be reappointed through 2021. Mr. Butler worked with 3 assessors of property, Owen Richardson, Vernon Long, and John Alley Jr. And whereas Mr. Butler, in addition to his service to Anderson County, has operated a number of local businesses, but is now mostly retired, mostly. Whereas Mr. Butler and his wife Barbara have been married for 55 years and they share 3 daughters and 4 grandchildren. Whereas Mr. Butler, along with other members of the Board of Equalization, in his own words, quote, tried to help people and we tried to be fair with them. And he has served Anderson County and its citizens with dignity, professionalism, and a welcoming demeanor, serving as a model of public service. Now, therefore, be it resolved that members of the Anderson County Board of Commissioners and County Mayor Terry Frank do hereby recognize and commend Mr. Don Butler for his commitment and dedicated service to his community through 36 years of devoted service to the Anderson County Board of Equalization and the citizens of Anderson County, duly passed and approved this 20th day of June, 2022.
Coming into office, knowing him with all of his experience, and I just want to thank him for his for the dedication and for the time he's given to the county, and then what I learned from him. That's, you just can't replace that, and I love you and I appreciate it.
I'll pay you when we get out.
All right. Yeah, he's it's been immeasurable the knowledge that he's got and property valuation, and then just dealing with people in general. It's amazing. I do appreciate it, Billy.
I appreciate working with you, Don, for 26 years.
At least.
We've had a good time together.
Well, I want to thank you all and thank my family, and also I've met some of the greatest people in Anderson County. I really enjoyed it and still think a lot of them. And that's it. Thank you.
Can we take your picture with the commissioners?
Okay.
Let's do that.
Thank you, Don. Thank you, Billy.
See you.
All righty.
Get up here, Billy. Do you care to take it?
You want to try to get back here?
You want me to-
Sure, you guys coming up?
Mr. Butler, if you'll go up there and stand in front of Josh and family.
Does the rest of the Board of Equalization, Mr. Ferguson, Harold White, do y'all want to come up?
Instead of losing weight, to be able to button my coat, I just finally got a beard.
All right, everybody say cheese.
Thank you, Mr. Butler. Thank you to the Butler family for letting us borrow him for 36 years. Commissioners, if you will indulge me, the next item on the agenda is a write-in edition presentation by Kayla Simon with ASAP. She does come to us on a regular basis to update us, so if y'all will indulge us, we'll go ahead and allow her to take the floor.
Sir.
I brought my phone up to keep time, not to distract myself. Thank you all for seeing me. I appreciate it. For those who don't know, I'm Kayla Simon. I'm the Executive Director for ASAP of Anderson. We're the prevention coalition that's been established in Anderson County since 2008, and I thought I'd give y'all a little update. I've been in the position now for 6 months, so I thought now was a good time for that. There we go. So I'm going to go over these super quickly for those who might not know a lot about ASAP of Anderson. Our vision is a drug-free Anderson County, and our mission is to reduce substance misuse among adults and youth in Anderson County. Our values are prevention first. It's the most cost-effective form of public health intervention. We have compassion for folks, and we try to increase knowledge in the community, connectedness among people, make progress and change what we've been doing, like I'll explain in a little bit, and then be proactive and assess the community and what needs the community has as they change, because I think we all know drugs don't stay the same for long. So our work, we, like I said, hang out mostly in primary prevention, so we want to get people before they use drugs, alcohol, tobacco, anything like that. We do this through media campaigns, training teachers, law enforcement, parents. We provide drug-free workplace, which folks can get a discount on their liability insurance if you're a workplace that has workers and would like that. We also provide responsible alcohol sales classes, point of sale material. Once a year, you'll see myself and staff burning rubber, going around town providing age verification material to every single business in Anderson County that sells alcohol or tobacco. We also provide safe medication disposals with our law enforcement partnerships, and there's some more coming that you'll see on our website soon. Also, home medication lock boxes for folks with young children who maybe don't want them to get into those medications, or if you've got a sketchy roommate, we don't care. We'll give you a lock box if you need it. And then public health policy advocacy. Secondary prevention, which is when maybe someone's been engaging in unhealthy behaviors, but they don't yet have measurable clinical signs of it, like maybe they haven't developed an addiction. What we have is P3 platform that's available in the schools for students. If a student sees someone who's using drugs or smoking or drinking, they can alert the system. It goes straight to administrators, and they can act on it. It keeps the student anonymous, so they maybe don't get retaliatory actions from other students. And we see an increase in students using this system versus students just telling teachers, hey, I saw so-and-so smoking or vaping in the bathroom. We also provide trauma-informed systems curriculum and life skills curriculum. Tertiary prevention, so someone's been engaging in unhealthy behavior and there are clinical signs of it. We distribute Narcan training. We distribute Narcan and provide Narcan training, and then we work with the recovery programs in the area to help them just do the best that they can do, because they got a lot of work. So some of the services we provide, like I said, is a drug-free workplace training, responsible alcohol, tobacco sales, and then state and national advocacy. Every year we go to Nashville and Washington to let elected officials know what's going on in Anderson County. We take our youth ambassadors with us, and they let them know what they're seeing on the ground as students in the schools as well. Also, it's a lot harder to tell a 16-year-old no than it is to tell me no when we advocate for certain things. Again, we provide age verification materials to all the businesses that sell alcohol and tobacco in Anderson County. provide Tennessee Save a Life training, or Narcan training, you might hear it called. And then we have our Youth Ambassador Coalition. If you've got any kids or grandkids who are real gung-ho and want to learn how to talk to legislators who want to go on a free trip to Nashville or Washington, you can let me know and we'll get them applied for the Youth Ambassador Coalition, which is starting in fall. So our impact from January to June of 2022, so since I stepped into the position, we've had over 100,000 traditional media hits, so billboards, radio, television, 2,000 engagements on all of our social media. We've presented to 748 people in Anderson, Morgan, Campbell, Scott, Roane, Granger, and Union County. We've distributed 98 lock boxes to families who needed them and collected over 1,000 pounds of medication that needed to be disposed. We've prevented overdoses by distributing 300 naloxone kits and then training thousands of people. So prevention works. So our goal is to reduce risk factors that young people experience and increase their protective factors. And prevention, like I said, is cost effective. In Anderson County, every dollar invested in ASAP saves the public about $17. In Roane County, it's about 14. Blount County, it's about 15. So our work is very important in reducing taxpayer burden on things that happen once people start using drugs, misusing alcohol or tobacco or vaping products. So these are our numbers from previous years. We averted 44 deaths in 2019, saw a 38% reduction in drug overdoses from 2017 to 18. We were one of only 4 counties that did that in Tennessee. And for every dollar invested in us saves the county about $17.73. And we saw a decrease in youth substance use from 2010 to 2020. All of y'all know that has changed. So in 2020, when the pandemic hit due to job loss, job insecurity, just everything that came with that, isolation, we've seen an 82% increase in drug overdoses in Anderson County. So we've had to pivot a lot of what we've been doing and address that. As well, we've seen a significant increase in youth vaping, both of nicotine and THC containing products that are confiscated by SROs in schools. So again, we're pivoting some of what we're doing to address those issues. So trainings and education, we provide, let me see how I'm doing, okay. We provide QPR training for folks who might encounter someone who has suicidal ideations. Catch My Breath is an anti-vaping program targeted at middle schools that we're implementing this year. LEAD is our law enforcement partnership we've been doing. Stalls and halls is something we started doing last year. Every bathroom stall and hallway in middle school and high schools in Anderson County has these little frames, and we replace them every month with messaging about Delta-8, THC, counterfeit or illicit pills, opioids, things like that, that are targeted at young people in language that they'll understand so that they know how to report issues, how to avoid them, and messaging that they need to know about those substances. We also have parent brochures that are going to go out to every single parent that has a child in Anderson County schools this year. And I'll bring that next month. They're still printing right now at C&D. And we have our Youth Ambassador Coalition, and you can come to all the football games, prom, and graduation to see us handing out information and just being a presence at those events, which can lead to substance misuse. And this is my information, my email. That's our office number. We're there 9 to 5, Monday through Friday, and also our general information Gmail account. Do y'all have any questions? And this is available. I can email it to anyone. They've also got it back there, and all of my sources are listed in the notes.
Any questions for Kayla? Commissioner Meade.
How can you possibly be in your office from 9 to 5 with all the stuff you do?
Yeah, so we have a specific Google account that's just scheduling, and we block off times like Kayla will be there 9 to 10, Stacy will be there 10 to 2. So Google helps a lot to make sure it's staffed.
I just really appreciate how much you guys do. So.
Thank you, and we appreciate y'all's support over the years.
Commissioner White.
Thank you. The bathroom stalls, both brochures that you put in there.
Yes.
Are they destroyed? Are they respected?
So we've had some framings destroyed in some of the high school bathrooms, and we just replaced them. We've got grant funding, so we bought more than we needed, and we knew that they'd be destroyed in bathrooms or kind of taken down or whatever, so we replaced them as needed. We're in contact with Anna Hurt. If one of them gets destroyed or taken down, we take her a new one and put it up.
All right, good, thank you.
Yeah, We anticipated that.
Commissioner Smallridge.
Use the term lock boxes.
Yes, sir.
What is?
A medication lockbox is about a 1-by-1 metal box that has a little lock on it, and you put your medications in there that you want to keep away from children. So we recommend that for families with small children especially, who might get curious or explore, or if you just want to keep them away, like I said, from a sketchy roommate or something. It's just something to keep your medications locked away that only you can access.
Very good, thank you.
Yeah, and they have medication. They have information inside of them about safe disposal, safe use, all of the sites where you can dispose of unwanted medication in Anderson County.
Commissioner Waddell.
Thank you, Mr. Chairman. Appreciate the presentation, Kayla. I just wanted to make sure, could we attach this information to our county website?
Yeah, anything you need. If you want it in different formats, JPEG, PDF, I'll get you whatever you need. Absolutely.
Thank you, Mr. Chairman.
Any further questions? Commissioner Jameson.
Excuse me for being late. You may have already said this. I've been reading about vaping.
Yes.
Is this growing like crazy? Is it as dangerous as smoking or not as dangerous?
Yeah, so it has been growing at, last I checked, the CDC said about 5 years ago, 1 in 20 high school students admitted to vaping occasionally. Now it's 1 in 5. So it's a pretty significant growth in a very short amount of years. In about the last 3 years, I'd say we've seen, I would say, a 60% increase. I would ask Anna Hurt at Coordinated School Health what she thinks it is. It might be higher. That's just what we know from empirical data. But what she sees, I would imagine, is a lot higher. We don't yet know, because vaping is so new. It wasn't on any of our grants or really on our radar like 3-4 years ago. There needs to be more long-term studies about vaping. What I will say, we know that when you smoke cigarettes, even a lot of cigarettes, you don't die from popcorn lung within days. Vaping products, have killed 80 people in the U.S. in the last 5 years from popcorn lung. It's where the chemical carrier that they use to vape to put the nicotine in chemically burns people's lungs so that you don't have enough of that capillary bed to exchange oxygen and carbon dioxide, so you essentially suffocate and die. The DEA has been really good about curbing that, because most of that was from illicit vape cartridges that were purchased through they're not regulated, but not from legitimate businesses. So they were like street versions of vape cartridges, but we don't yet know definitively the long-term effects of vaping, just short-term. But we do know nicotine is extremely addictive, and the younger you are when you're introduced to an addictive product, the more likely it is that that will adversely affect your life.
Commissioner Meade.
Is it not, I think the big thing about vaping is that back when people were just smoking grown tobacco, there's only so much nicotine and stuff you get.
Exactly.
But in vaping, it's whatever concentration it's made.
Yes.
And it can be 100 times more than a cigarette.
Exactly. That's one of the things that makes it so dangerous, is that it can be so much more nicotine than even an entire pack of cigarettes. And vaping products look like USB ports or like little children's toys. Like, they're very hard for parents and school teachers to detect, and they can contain a ton of nicotine, like more than a pack of cigarettes, which is highly addictive and we know causes long-term memory issues in growing brains. Thank you for pointing that out.
Any further questions? Thank you, Kelly. Appreciate your time.
Thank you.
Any further business for the consent agenda? Hearing none, we'll be in recess till 6:30 for the regular agenda.